For the Guam and beyond, this is Dr. Nguyen, the longevity doc. So I'm here with Dr. First at the Healthi Life Longevity Clinic. So I'm here on my first day on the consult, and we're going to talk about just go over my labs, the treatment plan, and he's going to answer any risks and benefits, and just go over through the procedures of any questions I've had. So far, just looking at the clinic, it's beautiful, and I haven't really even gone outside, but it's a great experience so far. So, I'm here to do some stem cell therapy and some additional kind of things to improve my health. So the main things I was looking to treat was I have bilateral supraspinatus or rotator cuff tears. Physical therapy has been helping me, getting me stronger, but I still do have some pain. So I was hoping that the IV stem cell therapy would do that last bit of get me more range of motion, get me out of pain. So I'll do an injection in the shoulder, but also I had some other health issues, like I would say long COVID, a little bit of mild renal disease, and some other things that I want to take care of, and I'll be doing the IV therapy of the stem cells with that. So that's what I'm here for in Thailand, in Bangkok, at the Healthi Life. So tune in, and we're gonna talk about this more.
Dr. Napat, so I have already have a look at the results,
Yes.
your lab result that you sent to us.
Yeah.
So this is your lab result, the interpretation. I think we already have sent this to you, right?
Mm-hmm.
Okay. So from the lab result, we found that you have mild low-grade inflammations. So I think that could be from many things, from your food, also from the cholesterol level as well,
Mm-hmm.
and also maybe from like your lifestyle also.
Mm-hmm.
So may I ask if you smoking or drinking any alcohols or anything like that?
Alcohol, maybe about on the weekends, maybe a total of 4.
I see. Only on the weekends, right?
Yeah.
So it's like occasionally, right?
Yeah.
I
Once a
see.
week, yeah.
So for your high sense CRP level, so you got a 1.1, so that's put you at, I would say, in the average cardiovascular risk. So usually we want it to be less than 1.
Okay.
So if 1 to 3 is gonna be like average cardiovascular
average,
risk.
right?
If
Yeah.
more than 3, it could be like higher risk for cardiovascular diseases.
Yeah.
And your ESR is also a little high as well at 19, so a little higher than the recommended range also.
Mm-hmm.
So overall, these would mean like low-grade chronic inflammations. So it could also be from the aging as well, because when we are getting older, we also produce some low-grade inflammation inside our body also.
Okay.
Yeah. And also for your kidney function, so your creatinine is a little bit high, not too high, still in the normal, but on the higher normal range.
Yeah.
So that causes your GFR to be a little low also at 26.
Yeah.
So may I ask about this? This has been going on for some time, right?
Yeah.
When you do the
So
consultations?
that's where my concern was. Probably about at least 4 years. My creatinine was hovering around 1.2, 1.3 sometimes, and my GFR was as low as 58. So that's CKD 2A3, right? So that's really concerning. But thankfully, like it bumped
coming
up
up
to
right?
70,
I see.
76, but still, I would like it to be above 90 at least. So
Yeah.
yeah.
I understand. So usually these things are caused by the vessel also. When your vessel becomes stiff,
Okay.
this could cause the perfusion to the kidneys become lower, and that is when your GFR is also lower as well.
Okay.
So we hope that the use of exosome and stem cell will help to improve this. Because it contains like the interleukins that help with the anti-inflammations.
Okay.
So it should help to improve the vascular lining and endothelial cells also.
Okay.
For your blood sugar, so at 97, it's still in the normal range, maybe a little bit high on the high normal. Did you do fasting during the testing, right?
Yeah, this is fasted, but
I see.
usually my A1C is a little on the higher side, maybe about. It ranges from 5.8 to 6, so
I
it's
see.
not ideal.
I see.
So I do certainly want to. Even when I was doing ketogenic diets,
Yep.
it never
It's
really
still
got below
high.
5.5. So
I see.
yeah.
I see. So that might be in the pre-diabetic range also.
Right.
And that could also be like the cause of the inflammation as well. And also, but other thing else is fine. Your liver function is also in the good range also. So everything is fine for liver function. Your tumor markers. So like for the prostate cancer or colon cancer, all of them are still in normal range. So that's good. And vascular marker, so the homocysteine, so at 11.6, so it's in the normal range, but still on the high side, because usually in optimal range, we want it to be less than 8 or 9.
Okay.
So this also indicates that you have like inflammation inside your vessel also for this one.
Have you ever had patients that had below 3?
For homocysteine?
Yeah.
No.
No. Okay. I just had one the other day, and I was trying to figure out why, but I think it was because her B12 was like in the 2000 range, like
So
twice the normal amount. So
it's
I was
high,
wondering
right?
if that was just converting the homocysteine excessively.
Could be also,
Okay.
yes. And are you on any supplement like vitamin B complex for this one?
Not right now. I'm not. Yeah,
I see.
typically.
So
right
I
now.
would recommend vitamin B complex that contain like B6 and B12 to help
Yeah.
with this also.
Okay.
And other thing, your electrolytes also normal as well.
Mm-hmm.
So the overall finding is that don't have any acute diseases or any rise in cancer screening or anything.
Yeah.
Only thing is the low-grade chronic inflammation inside your bodies, and also some lower in the renal function as well.
Mm-hmm. Okay.
So do you have any question for the interpretation?
So today's plan is we're doing exosome therapy and the vitamin D, right? Okay.
So this is the plan for today. We are planning to do the exosome, so it contains more than 50 billion exosome particles, these ones. And also other growth factor and anti-inflammatory interleukin as well. So like interleukin 6 and interleukin 10.
Infused with the exosome.
Yep.
Okay.
So this should help to improve your inflammation, also to reduce inflammation and prepare your body for the stem cell also.
Okay. So for the audience, can you explain what is an exosome and yeah.
So like exosome is like a baby stem cell. So it's the product of the stem cells.
Okay.
So usually the stem cell produces exosomes so to communicate with other cells.
Yeah.
So it would contain the interleukins or growth factor that help to with the regeneration of the other cell also.
Okay. And I've seen some crazy stuff with exosomes, like putting IV light therapy to activate it. Have you seen that before? Or?
Activated, you mean?
Yeah, I've seen some protocols where they flashed certain wavelength lights through the IV with exosomes. Have you seen that at all?
I have seen that one also, yes.
But you haven't looked into that or
I'm
done
not really sure because there is not much research on it yet.
that?
Yes.
Yeah, I don't think there's any much publications on that. Well, stem cell itself, there's pretty limited. Okay. So I guess why include the exosomes? Why not just the stem cells, or why not just exosomes? Like, is there a synergistic effect of using the exosomes and stem cells?
So usually exosome, we want it to help improve the inflammation inside your body first.
Okay.
Because when there is a lot of inflammation, sometimes the stem cell wouldn't be working as effectively as it could be.
Yeah.
And it should be, I would say.
Okay. And yeah, I'm pretty cool with the protocol. Though actually the one thing that makes me a little bit more nervous out of anything is actually the vitamin D. That's a pretty high dose, and that's going to be IM, 300,000 IUs.
So are you usually on vitamin D supplements?
Usually no more than 10,000. You know,
for the supplement, right?
Yeah, I mean 50,000's typically what I've seen, but in the studies I haven't seen. I've seen studies on ICU patients helping them recover with 300 to 500,000, but you know it's pretty limited. But is there a reason why 300,000?
So this one is a once-a-time injections.
Yeah.
So it can be lasting for 3 to 4 months.
Okay.
And it will help to like improve your vitamin D level by 20 to 30
points. Okay. Is there much risk in worst case scenarios like hypercalcemia or nausea or?
Usually because it is intramuscular injections.
Okay.
So usually it's like doesn't cause any hypercalcemia or anything like that.
Okay. All right. Okay. So we got the vitamin D, exosomes today, and the interleukins. And do you source the exosome along with the same stem cell source?
It's the same stem cell source, but we separate the batch.
Okay.
So the batch that we use the stem cell to produce exosome, we doesn't use that batch to also inject into your body.
Okay.
So it's a different one.
Okay. And each stem cell, is that from a new donor? Or is that kind of reproduced in the lab, or how's that stem cell? Like, how's my stem cell today or tomorrow used? Like, how's that sourced?
So usually we have the umbilical cords from the donors.
Yeah.
And then we store the umbilical cords. Mm-hmm. And then when you order the stem cell to be made, we use that umbilical cord to produce the stem cells.
Okay.
So usually the time it takes only be about 3 to 5 days.
Okay.
So that's why we have to 5 days in advance. And
Okay.
also we only use the passage tree. So when stem cell, during the passage 0 is like the first cell, right? And then we have the passage 1, passage 2, and passage 3.
Yeah.
So we use the passage 3 because we believe it's the most potent ones. And also the cell shape and cell structure is still the same to passage 0.
Okay. So that or I guess I'm trying to get the process. So that stem cell from the umbilical cord, and it's not from aborted fetuses, so just to make sure that's known. It's from healthy pregnancies or healthy babies, yes. Right? And so is that stem cell from postpartum 5 days ago, or is that stored, or how is that collected? Or?
So usually the umbilical cord is stored.
Okay.
It's stored, and when the order is made, then we made the stem cell from that stored umbilical cords. Okay. So our stem cell is not like frozen or anything, but the umbilical cord is frozen.
Okay. All right. Okay. I'm trying to think of any other questions. And we have NAD. The next day, stem cells.
Before the stem cell, yes.
And we're splitting up the doses. So I'm doing 30 million, but splitting it up into 2 days. Oh, the other thing I wanted to make note is typically this is a week process, because usually on the first day we would be doing our labs, right? To do the cancer screening and general markers for inflammation and metabolic health screening. So, but I was lucky enough to get those done in Guam, so I could kind of do my back-to-back treatments. So today, tomorrow, and the following days, 3 days in a row. But typically it's consult labs, like say today, and then stem cell about 3 to 5 days.
About 3 to 5 days after the labs.
Yeah. So that's just a travel tip. If you're time on a time crunch, get the labs, prerequisite labs done before you go in. Because I couldn't stay a whole 10 days or so, I wanted to pack it in.
So usually it could be like 5 days to 7 days. We could be adjusting it to according to your preference and your convenience also. Yeah. But if you have the labs already made, already at your place, we could do it in 3 to 5 days. Yeah. So it could be shortened also. Yeah. And then, is there a benefit to splitting up, 15-15, or why not all at once? So usually for the first timers, I would recommend splitting up the dose first to see if you are not doesn't have any side effects or anything from the stem cells. Mm-hmm. And also we will do the skin test first also before we injecting the stem cell as well. Okay. To make sure you're not allergic to it. Okay. What kind of react? Just the typical rash, or usually swelling, just typical rash, or hives or something? Yeah. But usually there is very, very little chance of allergic to the stem cell, but just to be sure. Okay. And what I've researched or looked into stem cells, it's been on my radar for a while, but if you're using fresh stem cells, the risk for accelerating cancer is pretty low, but are you just doing that as a safety precaution? Is that so that is also the reason why we do the tumor marker screening first, so to make sure that you doesn't have any cancer inside your bodies. But usually these stem cells are safe, so it doesn't divide or multiply unstoppable. Mm-hmm. So usually they are gonna divide for some time, and then when that shape is changed and their ability is reduced, they're gonna stop dividing and they're gonna disappear. So usually that's gonna take about 6 months. Okay. And I guess the logical question I also wanted to ask with stem cells, because there's different routes, right, through IV, which I'm gonna do tomorrow, but on the third day, since I do have a shoulder injection, I'm also doing intra-articular or supraspinatus injection of the stem cells. How different in efficacy would you say? Because would I get benefit from just IV, and that might only help repair by 25% versus injecting straight into the joint? Is there much of a difference? So usually the IV form, I would say it's very difficult for the cell to penetrate into the joint.
Okay.
So usually it doesn't help much with the joint if you have, especially for you if you have rotator cuff injuries. So the localized injection is more preferred for these conditions.
Okay. So I guess it helps more the major organs where you have pass flow of major blood flow, but not much blood flow in the joints. So that's why into the injections are more effective. Okay.
Because when the stem cells inside your body to the intravenous, it's going to pass to many organs first, like to the lungs, to the heart, and also to the kidneys and livers as well.
Okay.